CDC sending out a warning tonight. They say antibody tests may not be accurate enough to make important policy decisions. According to the agency, the test may give more inaccurate readings, particularly if the virus is not prevalent in the community. As a result, the CDC says the antibody test results should not be used to make decisions regarding people returning to work. The test should also not be used to determine the immune status in individuals until the presence, durability, and duration of immunity is therefore established.
And new reporting from NBC News tonight, also raising questions about the accuracy of COVID-19 tests. Experts tell NBC News up to 1 in 5 of them could be missing positive cases. Arju Hinkie explains.
Since March, dozens of tests for COVID-19 have been quickly developed, with the Food and Drug Administration granting emergency use authorization so they could be rushed into use. Now, NBC News is reporting experts believe tests used to diagnose the virus may be missing up to 20% of positive cases, meaning they instead show a false negative. There are several possible reasons.
No test is 100% perfect all the time.
Earlier this month, we talked with Dr. Maria Sundaram, an epidemiologist with Emory's Rollins School of Public Health. She said one type of COVID-19 test includes collecting specimens to test with a nasal swab, and if not done properly, the person taking the sample could miss the virus.
If I took a nasal swab and I tested it and it was negative, I just know that there's no virus in my nose, but there could be some in my throat.
Timing is also key, according to researchers with the Johns Hopkins Bloomberg School of Public Health in Baltimore, who published a study this month in the Annals of Internal Medicine. The lead author telling NBC News testing too early after exposure to the virus substantially raises the risk of a false negative. And quote, if you have someone who has been exposed and they've started to develop symptoms, it probably makes sense to wait a few days before testing. The research team found testing 3 days after symptoms appeared returned the most accurate results. Dr. Sundaram said antibody tests designed to find signs in a blood sample that someone had the coronavirus can also return false negatives. A person may have recently been exposed to coronavirus, but if their immune system has not had time to produce the antibodies needed to test positive, their test result would come back negative.
You won't see a big increase in antibody until maybe 2 weeks after the initial infection.
And because of the chance of false negative test results, no matter the result someone receives, positive or negative, Dr. Sundaram recommends they continue to follow CDC health precautions, including wearing a mask in public, social distancing, and hand washing to protect themselves and everyone around them.